Tori Korskin, and in today's video, we're going to insert an IV. So first we're going to check the order for accuracy and from the doctor, and then we're going to perform hand hygiene. Next we're going to gather all of our supplies. So first we have a cleaning device, chlorhexidine, we have a tourniquet, we have an IV catheter, 20 gauge, we know that because it's pink, and a transparent dressing. We have a stat lock, and we have a J-loop, a flush, and we're going to go ahead and prime the J-loop. Clear all the air out of the line. Okay, and then we have a 2x2 just in case we have to remove it or it didn't work. Okay, so we're going to ask the patient for name and date of birth, check for identification, ask them if they've ever had an IV, make sure that they know basic information for inserting an IV, and clarify any fears just in case. We're going to ensure that the room is private and ask them what hand is dominant for them. And in this case, it's going to be the left hand, so we're going to look in the right hand for a good vein. So next we're going to apply a tourniquet. We're going to feel the veins to make sure of which one to choose. In this case, we're going to choose the cephalic vein. And then, we chose a 20 gauge, which is pink. We're going to put on gloves. And prepare the site with antiseptic, and make sure that the area is dry for 30 seconds. Okay, next we're going to insert the needle into the vein at no more than 30 degrees with the bevel up. While applying traction to the skin. And then we're going to observe for a flash and lower it less than 30 degrees and advance the needle with the catheter. Monitoring for resistance while the hub is in the skin, apply pressure proximal to the catheter, to the hub. We're going to remove the tourniquet. We're going to apply the stat lock. Connect the J-loop. the stat log, and the dressing. And we're going to check for blood return. And flush. Next we're going to, when we're done, we're going to chart the date and time, the patency of the IV, the location, the size of the catheter that we use, the dressing type, the transparent dressing, any complications or any conditions that may have occurred while we were completing it. The patient tolerated this very well, and we only had to attempt the IV one time. So we're going to dispose of all the sharps and biohazard